If we could please stand for the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Well, we are without microphones or any AV services, so please bear with us. I'm going to start with some extremely unfortunate, sad news. We were informed that over the weekend we lost our retired former board member, Kathy Lemon, and obviously that's devastating to hear. As soon as we get more information, obituary information, service information, we'll share it with the rest of you. And we from the Board of Health and the Health Department extend our condolences to her family. And we are ever so grateful for 4 consecutive terms on this board that she served. So if we can just share a moment of silence in Kathy's honor. Thank you. Okay, if we can have a motion to approve our meeting minutes for the last 2 meetings on July 1st and our special Board of Health meeting on July 24th. So moved. Thank you.
Second.
Thank you.
Okay. Dr. Boxham?
Yes.
Dr. Brunt?
Yes.
Robin?
Yes.
Sylvia?
Yes.
Dr. Osan?
Yes.
Thank you, guys.
Thank you. Our next board meeting is scheduled for September 2nd. Summer is flying by way too quickly. And on to new business, we'll start with Powers Health with their update on the Rudy program. Thank you for joining us. I'm sorry for no...
That's okay. Do you want us to stand here, sit at the table?
Sit.
Okay, perfect.
Yeah, be comfortable at the very least.
Thank you.
We hope you didn't come on vacation, Lisa, to be here.
No, the timing was perfect, but I would have come on vacation. This is important, and we love our friendship and partnership with the Porter County Health Department. So I'm Lisa Kiger, Director of Business Development with Powers Health, and thank you, first of all, for having us here. We are very excited because we had a really great year with a program that we promoted in conjunction with the Porter County Health Department. Being a not-for-profit healthcare system, we are required to do every 3 years a community health needs assessment. This is where we take a look at the community that we live in to see what are the biggest health issues that our residents are facing. And we found, as in many areas of the country, diabetes is at the top of that area. So in addition to some heart issues, other things, but we really focused on diabetes. And so in partnership with the health department over the last year, we began a program, and Shannon will talk a little bit more about it in depth, called RUDI, stands for Reducing Undiagnosed Diabetes Initiative. Our goal was to really try to find people in our community who, number one, didn't even know about diabetes, and those who might even be pre-diabetic and not know it, or those who might even be diabetic, because that puts them at a lot higher risk for other issues and healthcare costs. So with Shannon, as one of our experts, and the Porter County Health Department, we were given the opportunity to get a mobile, it's called an A1C unit, that we can go out into the community, test the blood, and get immediate results. Shannon is a certified diabetes expert, I'm going to say, and she can tell you a little bit more about her credentialing, and also a registered nurse. But we found in about 8 months of screening patients, we did about 776 folks in the community, and we found of those who qualified high risk, around that 30% mark tested pre-diabetic or with diabetes. So it followed what we're seeing nationally on trends. We're seeing that right here in Porter County. So as a healthcare system, we also are taking that initiative. We are continuing, our senior leadership has really put additional focus in this area as well. And so we are coming to the health department to ask for your support to continue this program. But I will let Shannon talk a little bit more about some of the details, because she is the expert in this area. She is the point person. I can't say enough good things about her as far as what she's done in our community, the lives and the stories that I've heard from her, from those Porter County residents here who have been touched by this program. So I'll let you talk a little bit further.
Well, thank you. Yes, so my name is Shannon Hoff. I'm a registered nurse and certified diabetes care and education specialist, which is a special credential that you can get through the ADCES. And I've been doing diabetes education for the majority of my nurse life. And I think I was telling you guys this when I first came, that I've worked the inpatient, I've worked the outpatient, and I would hear over and over again that people would say, I wish I knew sooner. If they reach the hospital, their A1Cs are usually uncontrolled, or it's found on a whim because they went for surgery, and all of a sudden we can't do surgery because your sugars are out of control. And I always wish that there was something that could find people sooner. If they're going to the doctor, hopefully they're getting their screenings, they're getting their routine screenings. But the whole program has been completely eye-opening for me. I found things that I continually had to modify what I was doing because I didn't know what I was going to find, and I was actually amazed on what I found in the people I came across. So 776 is the estimated number of people that I've directly talked to. The people that I potentially made a difference, and I said, hey, have you ever been screened for diabetes? Have you ever had your A1C checked? I would say the majority of them said, what's that? And they immediately had handouts explaining what an A1C is, explaining those numbers you're looking for. Some people would say, well, gosh, I just had my labs done. And I said, well, I'm sure A1C was on there. They had no idea. So I encouraged them to take the risk test. So in order to receive the A1C, they did have to score high risk on the risk test. But they said, you know what, I think I just got labs done. Or maybe they didn't have time to stop, or maybe they, grabbed their flyer and kept walking. I don't know what happened after they left me, but they may have gone home. They may have talked to a loved one. They may have talked to a family member. They may have gone right on their My Chart and say, you know what, it is increased. Because are those pre-diabetic levels always flagged? Or does the doctors just say, hey, watch the white stuff? I hear that a lot. Someone told me, watch the white stuff. Don't eat the sugars. Don't eat the bread. Watch the potatoes. But did anybody get them in for class? So our healthcare system, along with lots of healthcare systems in the area, have classes. I had handouts ready for the participants, which had CGP programs for diabetes prevention programs in the area. Portage YMCA just started one, but I also gave them online options, diabetes classes at the other healthcare systems, whatever worked well for them. So even if they left, they knew that they were high risk, they had somewhere to go right after. Some people are very hesitant to go and seek health care, maybe because of financial reasons or fear. But those that I tested, that I did let them know that their A1Cs were increased, I gave them the class flyer, offered to sign them up, offered to get them a doctor's appointment. The majority of them declined. And I did find too much controlled diabetics. Actually, that number is now up to 3 because I just found them last month. Those people either hadn't sought any health care in the last few years, and I caught them at the gym, I caught them at the library, I caught them in very unusual places, and that's where I'm kind of sitting myself. I'm also directly connecting with companies because where you got to go every day, you got to go to work, right? So if a nurse sits in a conference room, sends you an email with lots of information, including the risk test and information about diabetes, and all you have to do is come over to the conference room. That's how I also found a lot of people. And those plans on how to find people continue to evolve. I came to you guys, I came to Carrie and them and asked them for ideas, and they sent me lots of ideas, lots of people to connect with. I connected with local factories, local hospice areas, and also the factory was actually a huge number. We had a lot of workers, and that was partially because their manager was very adamant about them coming to see me. She did great at that. But the things I learned was, I really could have changed the course of lives for at least 22 people, but potentially that 776 multiplied by 2 if they went home and told just one person. So what we're asking for is to continue to do this next year. The overhead costs are covered, right? The printer and the machine are already in our hands. I think we have a really good process down pat. We're also very strategic in how we use those testing kits because it is around $11, $12 per person to test them. I'm testing people who are reaching high risk, and I also wish to extend that to anyone 35 years or older. There is a standard from the U.S. Preventative Task Force that says really anyone 35 years or older who's overweight or obese should be screened. Now, if I did find someone that didn't hit the risk test but was 35 years or older and overweight or obese, I was testing them after asking them a couple of questions, such as, do you have any frequent urination wounds that don't heal? And after teaching diabetes for a long time, I have a little bit of a feeling sometimes, because that first diabetic I found, she didn't hit any of the criteria, but I asked her some questions, and thankfully we were able to find her. So we are asking for you to continue it next year. I think our impact can go well beyond. The numbers that I gave you are for 500 participants. This year, we directly screened testing. We tested actually 76 people. So as you can see, our goal is to go much higher. The process that we're going to be doing to bring people in, the intake form is going to be a lot smaller. It was grandiose in thinking I could gather all this information and throw that through a data analytics program that gives me a lot of information. But when you hand someone a long piece of paper with a lot of questions, they don't want to fill it out. So making it very quick, making it very efficient, getting through people quickly, and also extending that to those people that haven't had an A1C ever, who's 35 years or older and overweight or obese. So again, continuing to efficiently use those tests and getting to more locations and more people is my goal, because I think the impact that we're making can't be counted with numbers.
Can you touch base again on the locations that you used and the plan of where else you want to expand that to?
Sure. So
Because I love how you're going to people, right?
Yeah.
Not waiting for them to come to us.
Yeah.
And I'd like to even add on that, just so you understand too, our healthcare system, we are, to my knowledge, the only healthcare system that actually has a team of medical professionals that actually go into the community. So they are paid, so Shannon's salary is paid by this group. She is not in the hospital or in a doctor's office. Her 100% of the time is out in the community.
Right.
And it's exactly for programs like this. We also, part of that, the group has been together about 10 years where we've actually had this focus as a healthcare system. So we have partnerships with every school system in Porter County, where we're taking care of the teachers and their spouses and children. Many corporations here in Porter County. Gosh, we've got a lot of good connections, and so that, in addition, has allowed us, where people, Jen just told me about a client she was just with recently, and they're like, can you come back in November? So we already have the relationships with a lot of these companies and corporations where it's an easy access for us to get in, where it might not always be that easy for folks. So also libraries. We have a partnership with the Valparaiso YMCA. We've got a very good relationship with the Portage YMCA. So these are all great access points where we can actually get to folks in Porter County to test them. So, but Shannon has a detailed list. And I also wanted to add too, it took us a little bit of time. We didn't realize that we would have to go through the state of Indiana, and Dr. Osan was involved, but we had to get a CLIA license.
Oh, yeah. For any testing.
Yes, piece of equipment.
It just came up. I hope you just renewed it, right?
Yes, yeah. So we're hoping there was an easier way to get through the healthcare system, so that actually delayed us a little bit of time.
Once you've done it, now all you do is
Right.
renew. So it's
Right.
that initial clear,
Right.
yeah.
Well, to me, CLIA waived meant no CLIA, so I
Yeah,
guess
no,
I
you-
misunderstood that.
There's always
Yeah.
Again, the amount of information that I learned.
So we're going full force now, so
No.
we've got the equipment, it's really just for the testing kits
Yeah.
that we're coming back to, and we see the volumes going up this year.
And actually, some of the sites, I wish to just revisit them.
Yeah.
Because people might say, gosh, I saw that girl, she doesn't give up, you know? I guess I'll go talk to her, you know? So even like some of the outskirt libraries, I'd only maybe have like 2 or 3 people. But if I keep going and I do a little bit better job of maybe advertising in the community, again, returning to those places I returned before isn't a bad strategic plan.
No, not at all.
And some of the companies that I've gone to have asked me, can we schedule you 6 months from now, because people are talking. Even the last company that I went to, I emailed them. I always email them, thank you so much. You know, 7 people came through. Of course, I never give them names. But I say, you know, thank you so much for your time. I got an email right back. When can you come back? I know some people weren't able to see you today. So trying to schedule me right again. And I actually got an email from one of the participants thanking me for coming, and that he was happy to speak with me. So revisiting the places that I visited before, YMCA's, libraries, and then continuing to work directly with companies, because I think the working class, especially these households that have two working parents in them are, especially with young kids, they're too busy. And really, that's the age group. Really, 35 to 55 is kind of my target, and that's the working class. They might be too busy for the doctor's appointments, and they're not too busy for the kids' doctor's appointments, so maybe they don't make their own. So, really focusing on those companies, going back to the ones that I already went to and said, can we schedule 6 months from now? Because I know I didn't get all your people except for that one factory. Pretty sure we got everybody.
Did we have 23? Was it 23 sites?
23 total sites.
23 total.
I
That's
saw
amazing.
on here lots of Valpo, Portage, Cows. Did you go to Chesterton? I don't see any inland or Chesterton sites.
We went, what was the site in Chesterton?
Herschel?
Herschel?
We did do Urschel. We were at Urschel.
Yes, we went to
Health
a Urschel Health Fair. Urschel was actually doing A1Cs at the same time.
Ah.
So I got like 3 people, because they were literally testing blood, so I also know the right questions to ask next time I go to a facility, next time I go to a health fair. So those employees were getting their A1Cs done. So I was actually just, as they were getting their A1Cs, they were coming to my table and I was educating them on what that meant. So then I was like, well, when you get your results, here's class flyers and everything. So they were doing my work for me, kind of.
But we do have potential to.
They didn't know if you had any.
Portage.
They have a Y, too.
Portage Y.
The Dunland
Dunland Y.
Portage
The
Y.
Dunland Y, because we have 2
Dunland
libraries.
YMCA we could not go to, we did
Couldn't go
request
to-
because of their existing medical partnership.
Oh, okay. And the
Library.
in Chesterton and Porter?
So I reached out to the library head and I asked her to reach out to all the libraries and ask where I could go. And
Okay.
I went to all the ones that they said I
That they
could.
said.
And I did meet with Jake Casarda, who's the CEO at the Dunland Y. I do believe we have an opportunity
Okay.
coming up, so we spoke on it, so I think we'll be able to get that
And
in
I
the near
just let
future.
them know it's unbiased, right? So
Sure.
I don't just say you get an A1C, come to everything that we do. I give them a sheet which has all the information, all the major healthcare systems, phone numbers, addresses, and actually a QR code that they can scan, that they can go and schedule an appointment. And also all the information for classes that they can go to as well. So, and maybe they didn't understand it, but, but yeah, we could revisit going to the Dunland Y and see if that would be a good opportunity. But I'm always open to suggestions.
Yeah, I mean, we've had a little bit of feedback from you through the course of the year, just here or there, and I think we've obviously been very impressed with your outreach. And I'm sure you've kept up with the fact that our budget has changed, right? Our funding from the state was cut by 73% or 72%. And so we've already, had the opportunity to do our budget plans. And so we have already, begun with our process of being impressed with what you guys have done. And our hope is to be able to continue these types of services because we've been so pleased with what you've done. With each person, if you think of the cost of diabetes, extrapolate that out, and if we can get to preventative mode as opposed to fixing things after problems that are occurring, it's huge. Each one intervention is enormous. So, and I think, with all these different things, we're trying to bridge those gaps or those holes, right? And so you have these relationships where do we not? Where can we help, work together to get those holes filled, those gaps filled? And I applaud you for constantly pivoting, changing, gathering data, changing, and that's incredible.
And the treatment for prediabetes is a lot cheaper than the treatment for diabetes.
For sure.
A lot of people can't afford the treatment for diabetes.
And we're the same way, financially, it's like, why not come together? Let's not recreate a wheel and have all these different silos. How can we, as a health department and a healthcare system, and anybody else in the community, we're all about partnering together. It makes sense, strategic sense from a financial, from the numbers that we can impact, to come together. So that's really been our focus. It's about the people. It's not about one healthcare system or
Exactly.
It's about taking care of the people in our community.
And when you brought up the preventive task force tells us we should do these things, they don't always cover them.
Right.
I don't know how many times I get kickback, so you ordered this test, that wasn't covered. And so people are very cognizant of that, and they don't want those bills. So to have these things offered to them, I think more people would want to get it tested if they knew they could and not be footed a several $100 bill for it. So even though they're we recommend them, doesn't mean that they're always covered. So,
Yeah, I'm just, I think just even raising awareness, because a lot of people think that they're young, or they're not feeling like they have any symptoms of diabetes or prediabetes, that they're, you know, in the clear.
especially our young men, right? I think it's women in childbearing age we have that discussion, but young men, I don't think, when does anyone ever talk to them about that?
Well,
You know?
Yeah, and a lot of people don't even want, I mean, but even just putting that in their heads so they can even think about some of the stuff that you're bringing up and whether or not that's going on in their own lives, and if they weren't ready for a test at the time that you saw them, who knows, maybe, I mean, when you see them again, you know,
Yeah.
it might just be, you know, another opportunity to reach out to somebody that was not thinking that they needed it anyway.
Yeah, and our flyer that we gave out had that preventative task force quote on there too, so that these people are like, and we tried to put a younger man actually on our flyer, so hopefully people would, young men would look at it a little bit more too.
And to that also, I think one of our youngest was 21.
Wow.
Diabetic 23.
Wow.
So we're hitting those.
That's
young
changing
folks.
somebody's life.
Exactly, exactly.
Yeah,
So-
the location I was at, and
And a female.
she didn't go there, it was a female, she didn't go there to get a blood test that day.
No, but she walked out.
And she actually walked up, talked to me, walked away, and then said, you know, I'm here till 3, and she came back. So it's something that made her think, so.
I think that's a very impressive thing you're doing, outreaching. Have you thought about any other programs?
We have, as a matter of fact, we're hoping to come back in a future meeting. We are working on some metabolic syndrome, which we'll talk about a little bit more, but that actually encompasses, you can hit 3 of 5 areas, but it really covers diabetes, cardiovascular, and obesity. So those are 3 areas too. So we do have a program that we have put in place that we are hoping to come and partner with the Porter County Health Department as well. We have a couple other ideas too that we'll probably be coming to. We did have a little powwow. I know as a team we'd like to touch base and update each other to make sure we're strategically on track of our mission. And nutrition is another huge area. You know, obesity, all of these things, cardiovascular, diabetes, a lot of this ties to our nutritional status. And so, you know, we always say you can exercise the heck out of yourself, but if you go home and eat Snickers and Pop-Tarts, it's not going to do any good.
Yeah.
So we have an initiative, I think that it's really going to make, we've tracked this, we was testing before we bring them out in a partnership, that has been very impressive from a nutritional, and we have a team meeting this week, and so we're going to be talking further on that, but we're close to having something from a nutritional. I think that will also be easy, and I know I talked last year, I think, with the commissioners, an easy way to reach people in Porter County and beyond if need be, to help them understand nutrition and to make nutritious meals, and get that education. Because they all tie together, it all goes together.
That's excellent.
Advocate for the funding, please.
Yes. That's why we're here.
I know. We know it.
Because we've been trying to, the healthcare, the federal, we're facing those same issues, healthcare systems, and so once again, that's why we're coming to you, because we believe so strongly in helping folks in our community. And Shannon and our nurses do such a great job because the compassion and passion is there. I see it every day when and I hear the stories, so I'm very proud of everything that our team does. So.
Can you give me because since we don't have it up, we always lazy and I wait for that to come up and it's not up. I have it on my phone, but for those who don't, if you can give us the rundown or the summary of what we're proposing in terms of cost and what we're needing to continue the services and to expand in the manner which you need.
Yeah, so we're proposing to continue the Reducing Undiagnosed Diabetes initiative for another year, another fiscal year. With that, we're requesting funding up to $6,529.76. That would enable us to screen up to 500 patients with both the supplies to do so. And like I said, this would give us the ability to screen up to 500. We did break out the cost for 750 and 1,000. 750 would be $9,537.70. 1,000 patients would be $12,545.64.
And how many did you screen for this time frame that we're reevaluating? 8?
actual test cartridge use was 76.
Okay, so I think the 500 is generous. I mean, if we explore that, that's a good problem to have, and we can always entertain the opportunity to
We felt the
return.
same way. And
Yeah.
I think we can actually, with our focus this year.
Yeah.
And it'll be a full year.
Yeah.
The staff numbers are really.
Figured out the hard
worrying.
stuff.
Yeah, so I think it's definitely doable.
And then where we can hit.
Yep.
Yeah. So we're hoping to, increase our impact essentially by over 200%. Because 500 is much more than 76. But again, the impact will be exponential because, again, it's the people we're talking to, educating. Even if they don't receive a test, they're still receiving education.
And Carrie and Matt, that fits into our budget allowance of what we were planning on for this, right? Well, and, so we're being good.
I know, I'm like.
Fiscally prudent over here.
Yep.
And again, we request things as we need them, so.
Yeah.
We're
Well,
also
and the
fiscally-
upfront cost was covered too, so that's
Right.
nice while we had all the funding.
Essentially, your
that we could-
overhead
Right,
cost is
right,
gone.
Right.
And your fine tuning, so that's nice too, so that should help streamline.
And we're very frugal, our team, I say we have a.
We all have to
operate
be.
Well, I was the next left, like, we're the goodwill shoppers, we're always the second
Yeah.
hand, I'm like, okay, how can we cut costs? So we do come with we try to negotiate, we get all the discounts through our healthcare system on these pricing, so we try to get the best price.
Yeah, we had actually really looked at, because there's disposable A1C machines,
Uh-huh.
so we had looked at that, and long-term, I think you start to get more expensive even after the third year, so that's why we went this way, getting the machine and going for the cartridges, so we looked at that going forward, so that year after year, you're not compounding your costs by using the disposable A1C.
Well, I thank you for your efforts, and so I propose that we make a motion to approve the continuation of the Rudy program at the projected amount for your 500 patients at $6,528. Yeah.
Is that for a year? How
The
long?
year, full year.
You're starting when?
July 1st.
July.
So we're
July
already
to
into
July?
June 30th,
Okay,
yeah.
so,
We operate on like a reimbursable system, so really
Yeah.
reimburse for what they purchase, and then we can write it such that if we got to 500 and we would like to entertain you, we can.
Sure.
A little bit.
Yeah.
I'll second.
Okay.
What comments or?
I know, years, I know.
Dr. Watson.
Yes.
Dr. Brooke.
Yes.
Robin.
Yes.
Sylvia.
Yes.
Dr. Osan.
Abstain.
Oh, sorry, yes, gotcha.
We still have a quorum. And they're from state. We should all like jump on the All right, so motion passes. We have a
Thank you,
quorum. Yes,
thank you, we're looking
you.
forward to this
Yes,
year.
yes, thank you for
Thank
joining us.
you very much.
Yes, keep up the good work.
Thanks for
Yeah. Well, next up on our agenda is a request for approval to apply for the PCCS. Yes, I saw. Grant for AED registry.
Yes, so, as you know, anytime we go to apply for a grant or a funding opportunity, we always bring it before the board to make sure that this will be okay with you, you don't see any issues, is there a conflict of interest, or we should not pursue that funding opportunity or that program. So the Porter County Community Foundation has community foundation grants that come up 2 different times a year, in February and then again in August. And we are interested in pursuing one of those grants for the potential implementation for a Pulse Point. So what Pulse Point is it is an AED registry. That part of it is free, but then there's also a part for first responders where it's actually the way that they get notification from dispatch, and also the way that anyone in our community who might be citizen CPR trained could get notified that that AED has also been removed to help respond to that incident if they would happen to be closer. So this is a part of, and this isn't just, the health department would be writing for this implementation cost, but in reality, it would be one component of the entire county working toward being heart safe. And so at the same time, regardless of award of this grant, if we can write for it, we will begin gathering a strategic team who will write a strategic plan toward Heart Safe Porter County. There are no counties that are completely heart safe communities, in the state, and so once the administration building became a site, actually even before that, we had begun talking to community partners about that. And as the AED registry is one pillar, and this funding opportunity came up, it was just kind of seemed to make sense if the board would approve it to go ahead and, because we're a county health department, to go ahead and write for that implementation and then work with the strategic team for the annual payment for that. And so that is what we would be seeking.
What was the
approval.
amount?
So the implementation of Pulse Point is $10,000, and that's also what the grants are for.
So there's no added cost outside of the grant?
Correct.
And this helps improve response time, right, once it gets implemented?
Yes.
And that's always,
Yes, so
The
Pulse
best for
Point
the-
Responder works off of a different, it's not through email, so the notification doesn't go through email. So it's like an immediate notification.
And how does it work by text or?
Yeah, so you get an app and then it comes through your phone. Through the app.
so then if anyone's nearby, they can come out.
There's a bunch of different components and a bunch of different partners that get on board for it. And so we're working with Valparaiso and their chief and their assistant chief to kind of gather all of the players that would be involved for the implementation, and then also being the ones who carry it forward as far as the subscription for the annual subscription. And when we originally got together, we were thinking, well, would they be writing for this implementation? Because we knew that's what it would be for. But because the best idea would be to take it all countywide and to be an entire Heart Safe County and to get everybody on the same system, the same page, have all of our AEDs on there, and made more sense. It made more sense for us to write it than for just one municipality. And again, this would just be a one-time implementation fee, just the approval to write for that. And regardless of that, we still will work toward the other pillars of, Heart Safe community.
I could find no negative in this proposal. And I love that we in Porter County continue to try to be the leaders in the state, and, and so this is just another step forward in that, how we did it with this health department, and then if we can extrapolate that out to the entire county, that's who we are, that's what we should do. Very good, so I will propose to approve the application for the PCCF grant for the AED registry.
Second.
Okay, Dr. Watson?
Yes.
Dr. Brunt?
Yes.
Robin?
Yes.
Sylvia?
Yes.
Dr. Osan?
Yes.
Thank you.
Thank you. Old business, update on the public health emergency preparedness attachment, which we don't have.
No.
I have it on my phone.
So
We have no computer, microphone.
We had
or-
received a draft attachment B, which would serve as, basically they resent us the letter that we received last year to let us know that they have received notice of award from CDC and that we will be receiving the emergency preparedness funding. So in total, it's the $5,000 less than we knew that we were getting for our base, and then the same amount for CRI. So that was in draft, and so we were just updating on that. I know last, and then rolling to the next item, we saw before you, just for discussion, because it wasn't on the agenda last month, that we had some money remaining in the fund, and that was how we were proposing to spend the first half for 2025, just so that we could get that appropriated and begin to roll with the grant period while we kind of waited to get our contract and be able to execute that contract and to get started. Does anybody, I know we don't have it in front of us again, it was sent to everybody again in addition to having it last month. Does anybody have any questions about the proposed budget for the second half of 2025 for the emergency preparedness grant?
And I will move to approve the public health emergency preparedness amendment budget.
Second.
Thank you.
Okay, Dr. Watson?
Yes.
Dr. Brunt?
Yes.
Robin?
Yes.
Sylvia?
Yes.
Dr. Hassan?
Yes.
Thank you.
So that was point 1 and 2?
Yes, that was point 1 and 2. And then just to let everybody know, on our meeting this morning, they did say that they had sent out for signature the contract.
Okay.
We have yet to get it, so we're still trying to work out the email situation and the signatory, but that's great too. So, and I'll give a quick strength and stillness update, and then this will roll right into what Dave's talking about next. So for strength and stillness, that's the yoga program for the first responders, and then also for at Recovery Connection. We did get numbers for that for this month, and I believe they had 11 individuals for the first responder class in June. So we're waiting on July's numbers now. For the Recovery Connection, they were hoping to be able to, they're not adding classes, but move it around to different recovery centers. And they had asked if they would need to come back for board approval for that. I actually told them that I didn't believe that they would need to, that, you know, if they wanted to advertise it and be able to reach more people, different people in that way, that would be fine. Or they weren't requesting any additional funding or classes or anything like that. And so I just wanted to provide you with an update on that. So if you have any further questions for us to pass on to Sam, we'll kind of keep the information coming through the partner report, and then ask them to check in with us as we typically would.
Do they have a number for the, you said 11 for the first responders, do they have a number
They
for
have 11 for the
recovery?
first responders.
Sorry, I had to that there. I was saying the right thing.
Five at Recovery Connection.
Well, and I like that they're reassessing, seeing where can we pivot more and try to snag more people.
Yes, they're wanting to, so 320 Recovery has a really strong, they have a lot of very strong programs with a lot of draw and a lot of people that are in there nightly. And so they're hoping to go there and host a class and then advertise all of their classes so that they can not only get more people together pro-socially, but then also, you know, be able to get people to come to the other locations.
Very good. Report of board attorney. We made it in time.
I offer this not as a means of justification, but as a means of explanation why I'm late. I apologize. You know the story about the man who has one watch thinks he knows what time it is. A man with two watches is never really sure. And as you know, I discovered relatively recently, despite the wonders of modern medicine, that I'm probably not going to live forever. And so we've been trying to work Kobe Marcus from our office into attending some Board of Health meetings and working with me as we figure out what old men do. And that's what happened today. We had two watches, so neither of us really knew what time it was. And so I apologize for my tardiness. Fortunately, I'm far enough down the agenda that you didn't really miss me, did you?
Well, but we were worried.
I was worried. I did say that.
We were more worried than,
The one item under my aspect and part of the agenda involves the emergency preparedness contract. As you know, John has left for other parts. And it's the staff's recommendation, and we're presenting to you a contract for his deputy, Jeff, to move up into that position. I think Jeff has done a fine job, and we're perfectly convinced he's capable of performing the duties. The reason we're shrinking it down to 12, and I know I hear all this stuff about we've got the grant, it's in writing, we know we're going to get it. well, every time I turn on the television, somebody's not getting a grant that they thought they were getting.
Everything's changed.
We have enough cash on hand to have this position go on for 6 more months.
Yes.
Hopefully by then, we'll have the grant and we can extend it for another 6 months. And this position is unique in that it is a contracted position as an independent contractor, which means it has to be approved by the board as opposed to other ways that we employ people. So absent, and I think you got a copy of it in what got sent out. Absent any questions or concerns, it's my and the staff's recommendation that you approve the contract this evening with Jeff as our emergency preparedness coordinator for the next 6 months.
Motion to approve the emergency preparedness contract for Jeff for the next 6 months.
Second. Okay. Dr. Watson?
Yes.
Dr. Brunt?
Yes.
Robin?
Yes.
Sylvia?
Yes.
Dr. Osan?
Yes.
Thank you.
And again, I apologize.
That was the first time in all of my time here, so I give you one.
One? That's all I'm in
No,
trouble.
I'm just happy you were okay, everything was okay, I was just worried.
The only
It's so
thing-
unlike you.
We
The
only
only thing I'm gonna do is, I'm gonna take the Fifth Amendment about where I was.
I did not.
As opposed to here.
I think your face is gonna be on some milk cartons pretty soon. Won't be good.
We were gonna go do a wellness check. Yeah, we'll all be up at your door.
Because
An after party was at your
It's
house.
because we care.
Because I care.
Well, the claims and receipts have made their way around. If everyone's had a chance to sign, if we can have a motion to approve our claims and receipts.
I move to approve the claims and receipts.
Second.
Okay. Dr. Watson?
Yes.
Dr. Brunt?
Yes.
Robin?
Yes.
Sylvia?
Yes.
Dr. Osan?
Yes.
Thank you.
Thank you. Report of committee staff and health officers.
The only thing I have is, right before we came in here, we scheduled to go to our boot camp, September 22nd, 23rd, for our new health administrator, so I'll be there with Pat, and we'll whip them into shape.
Only take a couple more days.
Well, I just will add that we've been working together last week and the first 2 days this week, and I think we're going great. And I'm so thankful that we have this overlap time, that you're with us to help this transition process. It's exciting, and we're thankful for that.
Thank you guys. Thank you.
I think there should be a condition to his employment that Sheila has to come with him to at least every other board meeting.
Try to spend a little time first.
Good time. Oh, our health fair, our health and safety fair on Saturday. Woo! Yes. Round 2 in Portage this time.
Right.
Yes.
Yeah,
So that's exciting.
very exciting.
I have to know some of the things, I mean, all of this stuff that you guys send us, it just gets better and better each month. But there's just something about the school liaison report that excites me. And I love that you started a Porter County Health Department newsletter out to the schools. You know, Jess told me today that because of the school nurses reaching out, they had like record numbers of kids coming to get their back-to-school vaccine. And that, you know, communication, working together is exciting to see. And then I saw that you're going to be presenting at an Indiana Department of Health meeting about asthma. That's, again, like, I love us at Porter County being out there, being leaders, and I'm proud of all of you for doing what you do, and then helping the rest of the state along with all the information that you guys are sharing.
I have to tell you, on our last, we were on an all meeting. We were on the last LHG update meeting last Tuesday, and it was like, Porter County. And then Sheila, and I presume Sheila was texting me like, they're going to hate us, especially Porter County, by the end of this meeting, because they were talking, there was a semester or two, they were talking about Jamie presenting, and Sheila and I presented.
I'm proud of you guys. You're doing a great job.
Yeah, I love all those infographics.
Yes, me
that you're
too.
making. 'cause
I
that's
was just looking at what they, like, what the month is, and I'm like, my goodness.
I know, I love it.
It's like jam-packed.
It is
Yeah.
really packed.
It was like, I was just reading it.
And it's interesting because we were doing a research project on reading infographics versus just reading like text on a page. And it really looked at like the amount of time someone will spend reading the graphic, the amount of information that they actually can input and recall, significant, even though the same information is being, written in both ways. So, thank you for doing that, because it really just makes it much easier to digest the same amount of information, remember it, recall it, and then, it's fun, yeah.
Demetrius has made a video
Yeah.
about bullying, I mean, just all the different ways to get our information out there. It's very exciting to see. Well, this is our last meeting with you, is that correct? Well, I can't say that I'm pleased about that. I'm thankful for who we have to fill your shoes. They're big shoes to fill despite her little size. But I don't think things could have gone any better than they have, and I'm thankful for the opportunity to have been able to work with you for the last few years through a lot of different things, and the things that you've worked so hard to implement and initiate and get accomplished here in such a short amount of time, I think is pretty stinking impressive. Whoever ends up getting you next is a very, very lucky group. I hope you take some time off to enjoy yourself as you move to a new location, but whoever gets you will be very lucky.
I appreciate you guys so much.
And her going away party's next Monday.
You started talking, I'm like, just come next week.
I know, I didn't mean it, but I couldn't let the moment pass.
If we give her rotten enough.
Don't ask me for
recommendations, she'll have to come back.
I don't think there's anything that you could say that would upset Kevin enough to not take.
Oh, he's been patient, I give him that. Anything else that we may add?
Just thank you guys so much, and the staff, you're a great staff to make it
Very.
easy to be the administrator.
Any public comment who came in just in time? Councilman Vasquez, wherever you choose.
I'll
We
stand
have
right
no
here.
microphone today.
Yeah, no, I don't need it. Can you hear me in the back?
Yeah.
Okay, because I'm very shy.
We're
all
very
right?
informal today.
I'm here primarily for one reason, and one reason only, to tell this lovely young lady, our head of our department, that she will be greatly missed. Council is very thankful for all the work that you've done, and the fact that you did a fantastic job is beyond words. But we fear not, because we know that the gentleman that you have has been trained by the best. So we know he's going to hit the ground running, as opposed to just hitting the ground. And it was fortunate to meet him. And I would just like to say on behalf of the council, and especially myself, you're going to be truly missed, but we'll try to get over it, and we know we're in good hands. So thank you for all that you've done, and God bless. Thank you.
Thank you.
And truly, the board and the council have made this, I mean, your support, it would have been very, very difficult without support from you all right behind you. Thank you. And us, the department, could have done it without you.
Anyone? On that note, we will adjourn.